Have you heard of CLIA? Someone asking you, are you CLIA certified? CLIA stands for Clinical Laboratory Improvement Amendments, and it's a federal program that requires laboratories to be certified in order to perform certain tests on human specimens. So, are you a laboratory? How do you know if you're a laboratory or not? So, CLIA requires every facility that tests human specimens for the purpose of providing information for the diagnosis, prevention, or treatment of any disease or impairment of, or the assessment of the health of a human being to meet a certain federal requirement. So if your facility performs tests for these purposes, then you are a laboratory under the law. So in a full laboratory, you need a CLIA certification from CMS. In home care, you need CLIA waiver certificate. Okay, waived tests in CLIA are a category of tests that are considered simple and they have a low risk of an error. So yes, you're a laboratory if you're going to provide waived tests. Yes, you're a laboratory if you're going to provide complex tests and you need to get a CLIA certificate. All right. The list of tests that are under waived certificate, which you have to get if you're going to provide these tests, are here: pregnancy tests, rapid strep tests, urine dipstick tests, fecal occult blood tests, cholesterol tests, blood glucose tests. Yes, that finger stick that you have to provide every day at the patient home. If you're going to be providing the finger stick, then you need a CLIA certificate, CLIA waived certificate. I think of all those things that I'm going to be listing in home health, it's the blood glucose test that will require you to be CLIA um, certified waived test laboratory provider. Influenza, HIV, hepatitis, urinalysis, hemoglobin, nicotine, alcohol, drug of abuse tests, coagulation tests, microalbumins, hemoglobin, rapid cardiac markers, infection disease such as the RCV, flu, and COVID-19 are all waived tests. Waived test means you have to get a waived certificate. So if you're a home health agency and you're going to be providing any of these 20 things, this might not be complete list, okay? These are just considered simple, the one I'm talking about, the basic ones. The basic ones, right? So those basic tests, if you're going to be providing, you need to get the certificate. The application is pretty straightforward. It's not that complicated. And get the certificate. You will fail your survey if you're going to be doing these tests and you're not certified.